allergies, or even colds that last a long time. Your environment, meaning your home, outside your home, your place of work, or other places you spend time, can cause asthma or make it worse. Your doctor will ask you about your environment. This includes if you have pets, live in an area with a lot of grass, mold, or traffic, and spend time around people who smoke. An important asthma test called spirometry checks how well your lungs are working. You'll be asked to blow into a machine as hard, fast, and long as you can. If you don't blow air as much or as fast as healthy people, you could have asthma. You might take the test again after using a medicine that opens up the airways in your lungs. If your results improve, this is another sign of asthma. You might also have breathing tests after using a medicine that makes people with asthma do worse after taking it. Or you might have a test that measures a certain gas called nitric oxide in your breath. People with some types of asthma breathe out more of it than other people do. Your doctor might order an X-ray and other scans to look at your lungs. You might also have blood tests. One blood test checks the number of white cells called eosinophils in your blood. Some people with asthma have high levels of eosinophils. Another blood test checks the level of an antibody called IgE. Elevated IgE levels can be a sign of allergies. Skin tests may also be used to check for elevated IgE. A test called a bronchoscopy uses a tiny tube that goes inside your lungs. Through the tube, your doctor can take samples of mucus or fluid. The samples tell your doctor even more about your condition. Your doctor also should assess the severity of your asthma. There are 4 main levels or grades of asthma: intermittent, mild, moderate, and severe. Intermittent asthma causes symptoms occasionally. For example, you probably have a cough 2 days a week or less. Your asthma does not affect daily activities, and your spirometry results are normal or almost normal. If you have mild asthma, you have symptoms more than twice a week, but not every day. Your daily activities are slightly affected. You probably use a quick relief medicine, such as an inhaler, more than twice a week, and take a daily asthma controller medicine. If you have moderate asthma, your symptoms wake you up often. You use your quick relief inhaler every day, and having asthma impacts your daily activities. You take 1 or 2 daily controller medicines besides your quick relief medicine. If you have severe asthma, your symptoms bother you each day and wake you up on many nights. You use your quick relief inhaler several times a day. You probably take more than 2 asthma controller medicines but still have symptoms. You might feel like asthma controls your life. Knowing the cause of severe asthma can be helpful in controlling it. Severe asthma can be related to allergies. Your body producing too many of certain types of white blood cell called eosinophils or neutrophils, or overdeveloped airway muscles. An asthma specialist can prescribe specific treatment that can help. Many people with asthma have other health conditions. Some do not affect your asthma very much, and some do, such as allergies, sinus problems, and heartburn. Treating these health conditions can be important to help control asthma. Triggers is the term for things that make your asthma worse. It's important to learn about your asthma triggers and avoid them. Common triggers are cigarette smoke, dust, mold, grass or tree pollen, and pet or cockroach dander. Talk with your doctor or nurse about keeping your home clean and free of asthma triggers. For example, you can learn to avoid pollen and wash bedding to get rid of dust mites. If your home has mold or cockroaches, you or your landlord can fix the cause. If you have intermittent or mild asthma, you need to see a doctor regularly. If your asthma is moderate or severe, seeing an asthma specialist routinely is important. Everyone with asthma needs spirometry testing to check how their lungs are working. You might also need other tests to check your asthma. With regular care, you can keep asthma under control as much as possible.
stage 3 or whatever. So until we really define, oh, you have asthma. And before that, we have certain kind of symptoms they didn't realize, and then this gonna be developed to the asthma symptom. These days, air pollutions, and so much, the smokes, and even, when you drive, and then some cars is, the smoking out, well, those are all from the air pollution. Your lung gonna be really, have too much work to do. And when you breathe, this one is not only for your lung. That when you have some kind symptom, even cold and coughing, you guys think only about the lung. Oh, maybe my lung is not good function or whatever. But it's lung and kidney is directly to your breathing work, the lung and the kidney. So your kidney function is low and also affected to a lung function. So when you breathe in, that one is more like a kidney's work. Breathe in. Sometimes, they say breathe in and push down to the, your bottom tummy, right? And then breathe out. The breathe out is more lungs function. So kidney and lung is very very close to related when that's why if you have the cold and long time, and then flu, and then, a couple of days later, and the symptom gonna be changed. And then after 1 week, still, you have a cold symptom, the flu symptom, and that one is it's gonna be affected to your kidney. So not just only the cold medicine for the lung, it's not gonna work out. After certain days, it's changed the virus, that the type, and the cold, whatever the symptoms, entirely change. So Asian medicine, we treating not only for the lung, and we just tonify to the kidney, and then that the lung, whatever the symptom is better. Yeah, so it's especially, that if you have the asthma symptom, the same thing. This two is very, not only, the one, because my lung function is not good, and somebody has a lung cancer, lung problem, severe, the lungs problem. That one is, we have to treat the kidney too. So this one is very close to the, so even the breathing, as I told you, not only lung work, the kidney has to work. So it's, breathing out, breathe in, and also, not only one is work. So, and then we say, oh yeah, it's air pollution and smoking, and then that's when it's really gonna be hurt, for your lung. No, it's not. The lung plus kidney. So asthma, sure. How we can test? Blood test. Before, I don't know you guys, the complete CBC, complete blood test. We call CBC. When you have blood test, complete blood count is including what? Hemoglobin, and then white blood cells, and platelet count. Those are main count it come out. But it's plus WBC, the white blood cell. White blood cells is what? If something, the bacteria, virus is coming in, the the white blood cell is ready to fight with that. So like, you know, they're ready for the army, you know, they try to fight. In here, we have several different cells too. We call morphology, you know. The red cell is like this. Red cell. Excuse me. Sometimes this red cell's shape is something like this, or, you know. Then this one is thick red cells. So it's when red cell is low, it's not, we can say it's anemic, right? Anemia. But it's anemia, we have so many different kind of anemia. You know, anemia, oh, okay, you know, my hemoglobin is too low. I have to take the iron pills or whatever, you know. Like this one, round, but sometimes small. It's very faint color. But shape is like this one is, we call that's very important, sickle cell anemia. But this one is most of the black has this kind of anemia. The Asians, you know, the most of other country people not getting. And I don't know, this one is maybe heritage to have sickle cell anemia. It's, you know, the shape is like. And also, white blood cell has those kind. White blood cell, some of them, whatever, shaped like this, and some of them like this. It's very dark. It's different from red cell. And some of them, so it's we call this all different. You guys don't have to know. This segmentation. This one is the limb. If we have two, you know, that occur, the bacteria coming in and try to fight, right? WBC is trying to fight. From there, which cell is more active? So it's whatever bacteria infection we have, the lymphocyte is, you know, the increase, try to fight among the white blood cell. So this one is all belong to white blood cells. So asthma, when you know you got the asthma, when you have blood test, we can see the eosinophil. We say eosinophil. This one is when we look at the blood test, we have this one is actually 0 to 3 is normal. We're supposed not to see this eosinophil in the blood. But this one is, if we have more than 3, so for example 10, okay, then, oh, something wrong. Something wrong means this one is more like allergy. Just generally, we can say, oh, you have allergy. Okay, from there, we don't know what kind of allergy you have, but it's asthma reaction is kind of one of the allergy function, the allergy. So this one is the whatever we have, you know, the coughing and the breathing problems. Those are effective. We can say that's allergy, the generally allergy. You know, sneeze, and then what? The coughing, and then, you know, the itching right here, you know, some kind, even the skin reaction. Those are all allergy. So asthma is, and then before we say, oh, we don't know that she has asthma or not, but it's, oh, she has allergy reaction, the allergy. So when we can say allergy, we can find in the blood so many eosinophils. So when you have a blood test, the doctor, when they look at it, oh, you know, that they found quite cure the eosinophil more than 0 to 3. If you didn't see nothing, that's good. But if you have many, maybe you might have some kind of allergy. We don't know exactly what. That's why when spring comes, there's so many people allergy, and then sometimes tear, and itching eyes, and sneeze, so many reactions. And then from there, they have another kind of blood test for find out what kind of allergy. From there, we can find the asthma too. The beginning time, we don't really know. Okay, before that, this one is selected. I use, before I mentioned, better not use tea bag, right? The reason why tea bag sometimes, the 1 year, 2 years, it's okay. We can use it inside tea, but outside here, sometimes, it might have mold and then dust or whatever. So tea bag, I told you guys, never use. But if you have to, you like to use, but it's just first dip it, the hot water, and throw away that water. And then second time, you just do it. That's a little bit protecting whatever dust out here and bacteria out here, we can avoid. That's what, somebody might remember, I told you guys, don't use this tea bag, right? And then, now. So, and then, this one is related. It's sometimes, dry coughing, no reason. Oh boy, I have, some kind, my voice is changed, and then it's really bothering. And then breathing is hard time. So you might have some, the blood test. So when I give the lecture about the blood test is, cannot see everything, but some of them is really important. So, before I sort of emphasize, you guys, even you guys is healthy, maybe once a year, every 2 years, have blood test. Then, from there, and then you guys can tell your average. Okay, people has high blood pressure, and then high blood pressure means they said over 80 or over 70, he says here, and then high blood pressure. But as long as you know your standard, and then so, even the 145 over 80. Okay, my average is this one. And doctor, they just, measure blood pressure, and here, over here, they say, you have to, that's a high blood pressure. Maybe, they might say, you have to take the pills. But sometimes you don't have to. And then, okay, for example, the lower part, 70 or 60. And then, okay, all of a sudden, here's below that, the over here, this one is maybe too low. And then some people has the low blood pressure. And then all of a sudden, okay, 135 over 70. You are perfectly okay. But this one is compared with your blood pressure average, then this one is high side. So you have to, maybe, do you have too much pressure or too much anxiety or whatever. So those are blood tests, this means same thing. Okay, and then CBC, complete blood count. That one is simply you go to the doctor, they ask you blood test. They usually do this one, complete blood count, plus urine test, right? maybe you guys never been to the doctor's office. It's not, huh? And then usually, they ask in blood tests that they do complete blood count. Here, and then hemoglobin, and then the ladies, so around 12 plus minus, and then not over 14. Then your hemoglobin is 11 or 10. Oh, the people say that one is low. But you have averaged that. Maybe later on, something happened, and then you have blood test. Oh, I have a, from 10 to, I have a 14. This is the maximum normal size. And then something happened in your body. So that's why, I'm sort of recommend to have your own blood test, and you should remember, especially white blood cell count. White blood cell count is 5,000 to 10,000 is normal range. Okay, if somebody has, my average is 3,500, but this one is lower than this, right? And then, your white blood cells is too low. Maybe something wrong. It's not. So that's why I want you guys know what is your average blood count. Then when you go into the emergency, okay, all of a sudden, and then here, some people has 10,000, average they have, and then go into the hospital, maybe, the 11,000 WBC count came out. But that one is not really considerable. This one is high. But if somebody has 3,500 WBC count average, and then all of a sudden she or he has 10,000, that one is extremely high, right? So you guys can suspect, something wrong with me. And then usually WBC count, okay, for example, you have 5,000, okay, and then bacterial infection you have, your white blood cells gonna go up. It's gonna go up. And then virus infection, if you have virus infection, your WBC gonna be low, lower than what you have average. The reason why, and then virus, when virus is coming in, that's why that I'm talking about the blood test. And then asthma and the virus, from the air pollution coming into your body, and it's gonna be affected your white blood cells. That's what, that I'm just telling you guys. And then, so virus infection, when you have, is white blood cell gonna go down. Then you can figure out. The last week we was talking about the shingle, right? Shingle virus. Shingle is the virus infection. So if somebody, pop it up the single symptom, and they have, sure, when you go to the doctor, they do the blood test. Then automatically, your white blood cell gonna be down. So they can figure out very easily. Even the acute appendix, just for example, appendix. You have, the pain here all of a sudden, and go to the emergency, and they just do the blood count, complete blood count, CBC, and then, sure, if that one is appendix, is something wrong, and then that's inflammation, and white blood cell gonna be way high, and then they says right away, okay, this one is inflammation of appendix, they can just have surgery right there. So that's why it's very important, the blood count. So it's asthma, we just testing, and then blood test, and then for sure it's gonna come up that eosinophil number gonna be going up. Okay, they already suspected, okay, you have a asthma symptom, this and that, and the blood test prove it. And then from there, they can give you some kind, the pills or whatever. And then, I don't really like the pills. First they take it, but from there, we can just, try to avoid and then not to go to the smoking area. Or, that you should go to the fresh air place, and then even in the house, and sometimes it's mold, and then dust around the house, and then sure it's gonna be worse. And then if it's, that you have a high stage of asthma, hard to breathe. If you move around a little bit, still, that's and then, excuse me, I don't know these days, and so, asthma symptom, what you have, and you guys have really low energy feeling. Low energy. The reason why, sure, that the diabetes, somebody has diabetes, and then, they say, oh, I don't have energy or whatever. Yeah, even the asthma too. The reason why the lung is controlling energy, one of the kind of energy that's controlling. That's why that means hurting or too much the work, give it to lung. Then that one goes to the affected to the what? Kidney. Then kidney work is not really, that functional is not good. What? You go to bathroom often. Not really, I really want to go to bathroom. Just one time, maybe after a couple hours or 3-4 hours, you'll be okay. But it's not. This one, when you have asthma symptom, and then sure, different from the stage, but you go to bathroom very often, but it's not really very good. And then when you go to bathroom often, they might say, oh, okay, your bladder or whatever, but it's not. That's a strictly kidney work, the kidney function. So it's all related, that the organ to organ. So it's the first thing is the one you have one symptom, that's all around there. And then especially diabetes is more hurting lung, or sometimes the hurting what? Stomach. And sometimes really strictly to the kidney. So that's why it's the Asian medicine. We are, okay, if you are, diabetes, that focusing to what? Maybe the lung function is not good, or the stomach, or kidney. So all different symptoms. But here, Western medicine, they just supplies for the diabetic pills, right? But the Asian medicine, we cannot treat it that way. And then some people, diabetic, the patient, some people gain weight, But some people are gonna be really skinny, right? Some people can really thirsty, drink lots of water, or all different. That different we can, divide. Or this one is because of your kidney function. That's why you have a, diabetic symptom. Or your lung. Excuse me. So one symptom. So it's, that when you treat it, oh boy, that asthma, not only asthma. That's what, we call maybe what? Side effect. That one thing, that pill can treat it, asthma symptom, but beside that, we have something else gonna be hurt. That's the whole theory. The Western medicine show, you have to take it. Okay, for example, you have the thyroid problem, and they give you thyroid pills. And there is so many, I don't know how many we can tell, but it's so many side effects. Sure, that the high blood pressure pills, sure we have some. Cholesterol pills, sure. But it's, that we have to decide which one is more benefit. Take the medicine to control the main symptom or whatever the side effect. We have to really compare which one is really benefit for you guys. Especially cholesterol. When you take a cholesterol pill long time, they say that's the first thing they was worried about, dementia. Dementia. Oh, I'm so worried about the dementia. I don't want to take the cholesterol pill. Sure, you can do whatever, you can compare. But it's, that's what we have to really control it. So before that, prevention. So that's why, once the disease is the middle of disease, symptom came out, it's sort of too late. So before that, we have to have a prevention method. That one is overall our health, But asthma, what I was talking about, the asthma is here. So it's before, I'm okay, So, I'm very healthy or whatever. But it's a smoking area, and then, bad air area should not really, contacting and go there often, right? So that's one of the method you can just prevent, your thing. And then not only asthma, we have so many different thousands name of the disease. This and this and this and this. All, I can say all related. If you have some heart problems, sure, that's, heart related, that's lung, stomach, and all that. So that's why it's, and Asian medicine way treating is, sometimes pretty wiser to do things. Here, what they talking about, the asthma strictly, that your parents has it and then you can have. That one is sort of like, communicable disease. The reason why we say that one is because of the air. In this house, air is not fresh and not good. And whoever living here, everybody will get it. Those kind of things. So once, even you are healthy, and in just, if you have blood test, last time I told you about the PSA, prostate test. And then before, prostate patient is usually after 50s, 60s, and whatever. But these days, that age is keep going down, coming down. Even 30 years old. Not really symptoms, but it's growing there. Symptom is inside is growing there. You know, that the prostate. Prostate symptom is usually it's not really show up until, you know, prostate is really enlarged. So before that, if you guys have a, you know, blood test, at least you might have some idea, you know. Right now, I don't. Maybe after a couple of years, sure, who knows? You know, that it's gonna, you know, your lifestyle is changed, you know, your the food habit, you know, the whatever nutrition type, you know, the malnutrition, not, you know, coming out right away, just after certain months, and then after a year, who knows? That's why it's, you know, that if you try to protect your health, and then the first one is just same thing, you go to doctor, the first visit, blood test, and then sure, as long as normal, that's good, but it's you should know what's your standard when you are healthy. And if you get sick, that number gonna be changed, right? Calcium, sodium, whatever, sugar, and then all, you know, everything gonna be changed. So if you know when you are healthy, you know at least white blood cell count, average white blood cell count. So it's leukemia is what? Blood cancer, right? Blood cancer. The leukemia is WBC, white blood cell is really, really low, or white blood cells is extremely high. That's the leukemia, the blood cancer. Right, temporarily, you know, your white blood cells is go up. That one is, I told you, you know, the bacterial infection. That one is just temporary and then acute. And then chronic is, you know, high like that is something wrong, something wrong. So if we found, you know, the standard white blood cell count, if you know, that one is a hematology doctor. It's not just a regular doctor. Hematology means blood doctor, hematology. And then you have to have a special, you know, further test. And what is your situation right now? And that's very important. Any kind of disease is same thing. But it's, you know, now we're talking about asthma. What kind of food is good for, you know, asthma? But actually, for everything, every disease, it maybe can apply. You know, they say, especially here, this, yes, you need, so forth. But it's, you know, especially fresh fruit and vegetable is very important. You know, that sort of clean up your body, whatever, you don't need it. And then there, we're talking about the fruit and vegetables is main thing we're concerned about the vitamin C. The vitamin C, sure, there are a lot of ways we can use. You know, one of the Korean doctor, he and then study and research long time, and then he is, we call it vitamin C doctor. You know, he says we can take even 10,000 milligram a day. Usually, you know, 500 milligram or 1,000 milligram pills we're taking, right? But it's, he says 10,000 milligram can cure even diabetes patient too. But I don't know, I'm just, you know, that one is sort of a question. You know, vitamin C, if we're taking too much in our body, it's gonna, you know, just go out. You know, whatever we needed, that our body take it and the rest of it. But instead, a vitamin doctor, he is, you know, is really recommend vitamin C. Sure, that one is for all other symptoms except diabetic patient. Diabetes is what? Sugar problem, right? And fruit has lots of sugar. Compare just you know the regular white sugar sometimes more. So it's if people has diabetes symptoms, they should not really take too much fruits. So that's really obvious. But it's even that young people, sure, they love the fruits, that's good. But most of young people, they don't like the fruits and vegetables when they're young, right? And then later on, oh, they realize, you know, they take. But it's fruits and limitation. So except that any other disease, any other kind, and fruit and then fruit that fresh vegetable is very good. And then plus there, what? And then especially asthma, they says, you know, the pear, when they coughing, in the pear, that's you know, the Korean pear is very big and watery. The American pear, I don't know. It's just, you know, the Korean pear, the big, and then you just eat the meat and then skins or whatever, you can make the tea and drink. And then put it in honey, and it's gonna be, you know, the fungus is really smooth to do that. So, like, you know, now I'm just, I don't know, something, feel like something in here. And then maybe, you know, I make the tea and then put some, the honey. It's gonna be really smooth and gently, you know, I can drink or whatever. Yeah, that's the one of the fruit we can make the tea. Sure, you know, we can make a lot of different kind of teas, but plus the garlic. Garlic is, and actually, the one of the antibiotic reaction to the garlic. Garlic is good for, you know, your head. And then plus onion. And then because of the Chinese people, you know, they take a lot of onion. That's why it's even they taking all the greasy food, and that's can control, you know. So onion is good for, and then, you know, detoxify, and then helping, you know, the smoothness too. The garlic and then onion. It's not really same reactions, but it's pretty close. Pretty close. So if, you know, there's some of the Asians, when they need the antibiotic pill, they take lots of garlic. Garlic has antibiotic the action too. That's why it's, you know, and then even the other disease too, the garlic is good, and then onion too. If you know that you guys have a stomach problem, ulcers or whatever, then not the raw garlic or not the raw onion, just a little bit steaming will be okay. And then garlic, if you roast it, you know, smells is, garlic smells is, you know, go away, it's better. Or sometimes you can boil in the water, maybe, you know, that garlic, and then you can just take it too. So garlic is good for, you know, there's so many different ways to do it. So thing is, to whatever disease, and it's not really showing at the beginning, no, the symptom sometimes nothing. Like, you know, that the thyroid, low thyroid problem, and then you might have low energy. Oh, all of a sudden, oh, I'm tired, and then, you know, whatever. Oh, maybe, you know, I work too much, I did this and that, and then maybe I'm tired. But that one is one of the serious symptoms. So maybe, you know, that especially thyroid is not for the man. For women has a lot of thyroid problem. The reason why, you know, thyroid is right here, like a butterfly shape. But this thyroid, sometimes, you know, you're thinking too much, you do, you know, that some kind of pressure is hurting the thyroid. So that's what they say. Woman has more thyroid problems. So those are all, you know, the little symptom, unusual symptom. Oh, all of a sudden, I have a, you know, the muscle ache, and all of a sudden, I have some kind of headache. And then all of a sudden, you know, I lost my appetite. Or sometimes they say, okay, all of a sudden, why I'm so tired? Sure, just so you know that if you just compare normal life to the whatever is coming up, that's why you have to really close to your body to talk to. And then what was happening? And then all of a sudden, you know, I'm depression. Oh, all of a sudden, and then, you know, I have some hyper and anger. Those are all related with your health. Yeah, that's, you know, not only the virus infection, not only, you know, the bacterial infection. Some kind symptom, sure, that sometimes you don't even notice. And then all of a sudden, just pop it up. Oh, I was okay until yesterday, and then I go to doctor, and doctor says, your lung cancer, third stage or whatever. Yeah, it happened. It's happened. It's happened. So just, you know, that the normal daily life, you guys, you know, that, you know, and sometimes it's busy and thinking, doing something else, but it's just close to your body and talk to, and, oh, it's, what I'm doing here, and what's my body, you know. So that's the little, you know, the focusing for your health. You're gonna be okay. That's what I suggest. So that's the standard things, you know, blood test, like the, you know, complete blood count. That one is not very expensive, not very expensive. If you don't want to go to the doctor, you can just go into the laboratory, blood test laboratory, and then you can ask them, I want a blood test, you know, the basic things. Sometimes, you know, the complete blood count plus urine, or plus there, the old chemistry. Old chemistry means your sugar, from the sugar, cholesterol, and your kidney function test, and your what? The liver function, and then has around, you know, almost more than 20 different tests coming up. But not very expensive. Before, you have to go to the doctor to get the permission to have blood test. But these days, no. Even, you know, that before the healthcare provider, they cannot really order the blood test. But these days, you know, the healthcare provider, such as what, acupuncturist, and then, you know, chiropractor, they can order the blood test. So it's pretty simply, you can have information from your body, for your body. And then especially, you know, the people working in the hospital, and that one is, you know, that they just contact sick people, right? So some diseases communicable disease, right? And then from the air, or when we're talking, or sometimes, you know, the skin touch, and then if you have some kind, what? And then, you know, even the pimple type, it can cause, you know, the contaminate. So usually, you know, when they working in the hospital, and so every 6 months they have blood test. But like you guys, it's not really that often, but it's at least, you know, once a year is good, but it's, you know, every other year I have a pretty good, you know, immune. The white blood cell is more like, you know, the immune system. If white blood cells is low, your immune system not gonna be good. So, for example, virus infection, like HIV, AIDS patient, their white blood cell count, whenever, you know, they have a chemotherapy or whatever, they have a blood test that's went down. If it's white blood cells too low means like 1,000. Sometimes, you know, when they have chemotherapy, the white blood cell gonna be really down. Sometimes 500, that's way, way low. They cannot get the chemotherapy or treatment. They cannot have that. They cannot take the pills. So, complete blood count, from there, the white blood cell count is always coming up. Very important, very important. And arthritis, the patient, you know, sure, they just taking what? Some kind pain pills, right? Some kind pain pills. And then if some, you know, the pain pills, it doesn't work, and then doctor give you a stronger one, or they give them shot. That's make what? You are weak. You know, rheumatoid arthritis is also like a virus things. So your WBC is going down. Oh, from there, that medicine is a platelet. Do you know the platelet? That one is in the blood, the main hemoglobin and white blood cells and platelet. Platelet. This one is, those three of them is very important. If platelet is controlling your blood holding, and if this one is really low, your blood vessel gonna be anytime broke. So arthritis, rheumatoid arthritis patient, when they taking too much pain pill, and then platelet gonna be go down. This one is the really, you know, the common the common ad, but it's very important. And then maybe around you guys, and somebody has arthritis patient, and they have all kind of bruise. Even they touch a little bit, they got bruise. The reason why the blood vessel, capillary tube, is easy to break up because of this one is low. So if you have easy to get the bruise, and you know, oh, I hit this table, okay, I got big bruise. Some people is not maybe, and compare. And then, you know, oh, I just, you know, fell down, and then some, you know, that I got a big bruise. That means your blood vessel is not strong enough. So outside is okay, but inside, if you have internal bleeding, you don't know. So that's why, and then arthritis, and then if it's really they have pain, and then they usually, they treating like, you know, the cancer. And then when they got some shots, they cannot take the pills anymore. They got the strong shots. And then we always have blood test. That's make the basic complete blood count. In here, this one, hemoglobin, and then white blood cell, and platelet count. So usually arthritis patient has low platelet count. They cannot get the shot or whatever. You know, from outside, you don't really know. So the one day I was working in Kaiser a long time ago, and then one patient just walked in, and you know, I was working in the special hematology or the cancer, the patient, before they got the cancer treatment, we have to have a blood test. And then she has 600, I still remember. 600 means the platelet count that the unit, don't think about it. And then 150,000 to 300,000 is a normal range. And then this one 600, what? You can tell, huh? She has internal bleeding all over. Can tell right away. And then arthritis patient, they are not dying because of the arthritis itself, and then internal bleeding. So sure, right away doctor admit that patient, following day, she passed away. She died. And then internal bleeding, her body cannot control it. So that's why, the blood test, I'm not saying blood test is, that you can find everything, but it's as long as you guys just know, what is your normal, white blood cell count, or, it's just one sheet, they just give you all the information, and then what's the normal range you are aware, and too high, too low, or, the normal range is right here. The little bit, plus minus 5% will be okay. But if you know your standard range, and then later on, if you are really sick, oh, I usually have that one and this. So, and that's why, that I sort of recommend your, the one of these days, have some blood test and keep it. That's for your health, the protecting your things. That's why, and then complete blood count and urine test is maybe around $20 to $30. I think that you guys can have your own research. If you have doctor, they say, oh, I'm going to send it to your doctor, and doctor will give you that report. And so if they have 5, and later on something happened, we can compare whatever. That's very, very good for your own protections. So all kind, different disease, and then, some basic blood count can tell, and then why. Some people just say, oh, I have headache, Advil. I know one of the lady, and I play golf with her. She is super, she's the white girl. She's super nice. But I don't know, maybe that's addicted to the Advil. Advil is good, painkiller. But it's, if you think about it, if you're taking, what, year, 2 years, 3 years, 4 years, just whatever, that the function, that effectiveness, to the her body, and then finally, later on, that Advil, whatever, for example, 50 milligram is not working, 100 milligram, and going up and up and up. And then these days, before aspirin, when you take the aspirin, your stomach trouble, right? You guys cannot have good digestion or whatever. If you have an ulcer, sure, you cannot take the aspirin. And then, something else like Tylenol, and those is okay. But it's once you know that you're taking long time, that's gonna be really, really hurting, you know, for your organ. And then once you hurting the organ, and that's all affected. You know, I've been telling you that that's why the Asian medicine is. When mother is sick, kids is sick. When kids is sick, mother is sick. Yeah, directly, indirectly. Yeah, but it's just all from your heart and everything. Not only physically get sick. It's all got the same thing. When your lung is sick, sure, your kidney or your heart or your everything just, you know, rotated, related. And this way or that way and whatever. Like, you know, that son, you know, kids, mother, husband, relatives, those kind. If you are not well, you know, even the financial things, your health, all well, right? And they are worried, and the mother is worried, and the kids is worried, and then from there, another, and then relatives, all affected. The same thing, our body is the same thing. So even I'm talking about the asthma, but you know, the other thing too. Oh, I don't have to worry about that, and then I have to worry about my digestion. Sure, the asthma is affected digestion too. That digestion, if you have a good digestion, it's like helping the lung function. So all, you know, go around. So that's why, you know, something you're treating yourself. You know, I should not really say treating, but it's do something, even the foods. Okay. Oh, black beans, good for your kidney. That's what everybody says, a bean is good for kidney, right? As long as, you know, the kidney is strong, what? The liver gonna be strong too. If the liver is function good, and then all emotional thing too. If somebody is really hyper, and especially kids, when they drink too much sodas, too much salty chips, they're gonna be hyper. The hyper, sure, that only we cannot really look at. We should not look at it. Just only the hyper things. When it's hyper, what? Your hormone balance is all jiggling. So one is wrong, the other one is wrong. So right now, oh, I'm okay. I'm you know, that I don't have any problem, but it's sometimes, you know, you cannot sleep. You have a reason why. Nobody, you know, that you could sleep, and it's one day I couldn't sleep. Maybe you have too many things to, you know, the worry or thinking, and then, you know, all those unseen pressure. So maybe that's why you cannot sleep. Okay, if you're thinking too much, that one is affected your spleen. Spleen is, you know, if you think too much, spleen gonna be hurting, effect. And then if you too much think in the spleen, you cannot have good digestion. So it's once you know that you have one, okay, I cannot sleep good. Why? Oh, last night, you know, that I didn't really sleep good. But not only that, all your body is already knows, you know, internally. So sometimes, and then the people say say meditation. The reason why the meditation is you talk to your body, but you talk to your mind, without saying anything. Sometimes, you can feel it, why? So that's why, that if you go to church, pray. It's very important. Very, very good. And just, sort of like a relaxing. The relaxing, they say, oh, just relax. How can I relax? I have too many things in my mind and too many things I have to do, make money and, go to friends, this and that. And even when you drive and all the pressure, your body is already, reacted there. So that's why, and then one of the prevention medicine, not the really medicine, even the meditation is one of the good medicine. So, and even meditation, when you go to the meditation group, maybe that the instructor might say, okay, even 2 minutes, 3 minutes, your body can just relax. And then plus deep breath. Deep breath is what? It's helping your lung and your kidney. It's very important. And so if you have those kind of habits, I don't think you never ever have asthma problem. No. It's good. So that's why, the people goes to the mountain and sit down and deep breathing. And that's really, and then preventation, and your health gets sick. So it's, that once you get sick and then take the pills, and then if you look at it, the side effect, I don't think you guys can take the pills. Side effect. Side effect, side effect is sometimes worse than what you have, your body condition, disease, the side effect. So one pill, sure, we can try to cure one of the disease, one of the symptoms. But from there, and that's why even cancer pills, when they try to kill the cancer cell, but they cannot just select cancer cell only. They killing what? Good cells too. So one way is benefit and the other way is, unbenefit. So which one is, we have to think about what is best, the balance. That's why before you're taking any pills, you have to think about, and what I'm taking the benefit from this pill, what bad things I'm taking this. Those are very, and then if we are hungry, we're just taking what, hamburger or hot dog. Okay. Make me full, and maybe this one is, and then really need my body protein and carbohydrate and then all that. But from there, what's bad food is how it's gonna affect it to our body. So just that little things, you guys think about it, and then maybe from there it's really, make you guys healthy. Before you get sick. Once you get sick, it's hard to, going back to the healthy life before. So, after that is very, that's why it's the daily and then nutrition. The malnutrition is, that's the worst condition for your body. And so every day, daily, what you're eating and what you have to do. And plus the nutrition plus, they say exercise. Yeah, but the exercise is very hard, huh? You know, the regularly you do exercise, it's so hard. Don't get the pressure from there. Just even 1 minute to 5 minutes at home, do some kind movement. Even that 1 minute is make your body happy and then relaxing too. So just, you know, little by little. Don't do, oh, I have to run in, 30 minutes, 1 hour, go to the gym. That's too much. That's what I'm thinking. That's too much pressure. If I missed 1 day, oh boy, I missed 1 day. What I'm gonna do? Those are all pressure. And then your body not talking, but this one is talking. Your body is talking to you. And so you have to listen to your body. Sure, that they say it's overwork. I don't know what is overwork, but your body can tell. Once you do something, oh, I'm a little tired, you gotta stop, that's okay. So that's why, even when you work in the office or whatever, they give you what, 15-minute break, huh? 15. That's we have, the reason why we do that. Sitting down and whole hours, sort of too long. They say around 30 minutes, you have to get up and then just the little movement, and then do again. Even front of computer, I sometimes front of computer, I have 2-3 hours. I'm sitting there too, but it's once you forget, it's I have to do, and those are important. Then what you're taking too, and then sleep. Oh, most of old people, they says insomnia, they cannot really sleep good. The reason why, all those years, your body is already, it's computerized. They took all the pressure and the worry about the money and kids and this and that. That's why your body is already. So even from now, you guys young. I've been telling you, our age now, they say, okay, 100 years old, we can live. But I don't think so. Some people, yes, but not many percentage-wise. The more than before, but it's still, the 100 years, no. And then 85, when it reaches, that 80, is already what? So only 20% alive. When you reach 90, so they think, everybody can live 90 or 100. No. But your age now, they say 150. Can you believe that? Sure. I believe that. It's around 50s, and then they say they can live 120. So even from now on, you guys, oh boy, how come I'm always tired and I don't want to do this and that. Starting now, just little by little, you're gonna be very good health. And then, when I was around early 40s, I was really sick. I was really sick. And I have a low back problem, and maybe, that I have 2 kids, do this and that. I always, running around. I have to do. That's what I saw. But I don't have to. Just, the little by little, you can do this, and then you can take rest, and then. So right now, you guys, just if you, controlling your time, your life managing, you're gonna be really, really good health. Finally, the last, you guys reach my age. Oh boy, I don't need money. I don't need this, and it's only health. You guys might say and 30s, whatever, boyfriend or girlfriend, and all different. But it's, that when you get old, you don't need it. Kids, no, they grown up, they do their own things. So don't worry about too much now. And then your husband, it's okay, get old. Your health, your body, nothing else. The money, no. Yeah, when we was, around 30s and 40s, house, this and that, we have to have maybe minimum 10,000, huh? Now, maybe, at my age, we don't need that much money, and maybe 1,000 is enough for living the whole month. So money is, so that time, your health. I realized after, that I got really sick, 40s, and almost 7-8 years period, I was really sick. Dizziness, back pains, and this and that, and then when you go to the doctor, the x-ray, and, MRI, nothing show up, but still, that you get sick. But that one is too much, maybe too much in your mind. So now, just relax and then do whatever you have to do slowly, and then you will be okay. You guys will be okay. And then when you reach, the high 70s, 80s, and then you're still gonna be good health, and you will realize, how important your health is. So think about, what you're eating and what you do, and those are, for future prevention. Okay, this one is sort of like a health class, and I just emphasize for you guys. Okay.